Today we are with Sarah Burgy of SB Network. We work in the Dallas area, and she's going to tell us a little bit about her business, what she does, and some of the providers she works with in the Dallas market. Thanks for joining us today.
Thank you so much for having me. I feel like I already know you, so it's such a pleasure to be here.
I love that. It's long overdue. Sarah and I have both worked in the healthcare market in Dallas for multiple years, have worked with quite a few providers, and one of the missions that Sarah is on now is, of course, connecting some of those providers and specialists so that they can work together, collaborate to enhance patient care. So why don't you tell us a little bit about that, what you're doing, some of the work that you're doing with providers in the area now, and how that is impacting patient care?
Absolutely. I love how I became SB Network. I guess it's not just me, it's a whole network of physicians, but I really do want to work with and do work with independent specialists. So a lot of times over the years that I've been in healthcare, I've seen so many providers start their own practices, really grow, really build. It's been inspiring. And one of my clients actually did that himself, Dr. Merchandani with Save a Pain and Wellness, and I met him when he left Metro Anesthesia to start his own practice. And over the years, I mean, as you have your own children, your families, you caretake, it really became apparent to me that that personal connection between providers and the specialists that treat that patient was super important, that it was personal, that they were talking to each other. And during the years in the hospital, I saw that with departments, the ER, talking to the hospitalists and the surgeons, just making sure everybody knew each other, had each other's phone numbers. So when I did start SB Network, that was my goal. Dr. Merchandani became my first client, which was wonderful. And then I really wanted to start thinking about, okay, which specialists can collaborate with each other. So then Dr. Steve Appleton, he's a total joint surgeon. And I mean, I think, oh, he can refer to pain management. And then it's like Dr. Ruby Shaw, she does weight loss and wellness. A lot of their patients also need more wellness and weight management. And then, oh, they might need physical therapy. So then you have Meredith Tittle with S2S. And then over the years, a lot of people have heart issues. So like Dr. Rishenshaw is an interventional cardiologist. So it's really nice to see how everybody can connect and how they can collaborate. And I mean, then it's a rheumatologist, and you think, wow, all of these people can connect with each other. And I like to go and get to know all of the family practice internal medicine offices in the area and be a resource, because even if it is not a client of mine, I have a pretty good understanding of the specialists in the area, whether we recruited them in for a practice with HCA or whatever the reason is. I want to also be a resource for those offices, because they are desperate sometimes to get a patient in quickly, and they don't know who to call because they can't get in X, Y, or Z, or they don't take that insurance. And luckily I do have a lot of that knowledge in healthcare to be able to be a resource as well, as helping my clients connect with other physicians.
I love that. And I think that's something very amazing and impactful behind the scenes. Of course, in the healthcare scene, you need the different specialists and different providers to collaborate. And so that's one of the things that, just as your mission to complete that and make sure a lot of these physicians know each other, work well together, and of course then ultimately impact patient outcomes. I think that that's one of the things that has been missing, or is missing quite often, because there's some providers that might work together, they may end up retiring or move to different markets or different parts of the world, even not just US or even Texas based. So I think that the connection of the care providers is very pivotal. What is one of the things that you would say has been the most impactful for you, being able to connect some of these providers and actually see, wow, this patient received better care because of the collaboration between physicians?
Absolutely. I think it happens as I have family or friends, and they'll ask me for certain places to go, or maybe their mother, for example. I think I was telling you earlier, an old nanny of mine, and 15 years later, she's set up for a double knee replacement, and I asked her daughter, do you think she would be open to a second opinion? So then you see it, and then you get the feedback. She's like, they love Dr. Appleton, he's fluent or he's speaking Spanish, and he's funny, and he just brought the anxiety level down, and that is really impactful. And then when you hear that feedback, you feel really proud about what you're doing, because these providers want to grow not only by connections, but then it's also working with people like you. Like, how can they grow and expand their name and their brand? And when I first started in a role that was similar, like, I didn't know that providers needed marketing or connections to get patients in the door. It's like, yes, everybody starts out a fellowship, and they don't know what to do. And then if they want to expand their practice, where do they go? What city's best? What part of town? First floor? I mean, things like that. So I think that personal connection when I've sent family members and friends and I get wonderful feedback.
I love that, because that's been an experience for me as well, referring friends and family members. And it's a part of you also to see that patient journey. Like, while it might be your mom, your dad, your cousin, brother, friend, family member, of course, it also is something that you can be proud of on a professional level, knowing, hey, I was able to refer to somebody, of course, to get that excellent patient care. So one of the other things that I do want to talk through with you is, like, when you're working with some of these physicians, I know that you've mentioned in the past that you set up some of the physician meetings or kind of mixers, maybe seminar type things where providers can collaborate. So maybe that's something that we can discuss, talking through some of the events that you're putting together to bring some of these providers together as well.
Absolutely. So currently right now, one of the areas of medicine that I was not as knowledgeable about is the post-acute space, the senior livings, the hospice, the home health, the inpatient rehabilitation. So I've really tried to make some connections in that area, and it's been very beneficial getting to know them. And one of the groups, Pam Health and I, we put together a mixer, and a lot of them, they have different senior communities and their marketing team, and a lot of them hadn't interacted with the providers themselves. So the first mixer we had, we kind of called it like a junior high dance, because you're the providers and it's like, okay, go and meet somebody, because in that space a lot of times that particular whichever it is will refer back to a primary care, when maybe their next best step is to go back to a specialist.
That's right.
If they need pain management, do they need a cardiologist, do they need these other specialties that aren't primary care, because maybe they can't get back into their primary care for 3 months after discharge. So it's really connecting that and closing that gap, and that gap in care. And then if the providers that I work with and specialists can meet the physicians that are on staff at these different areas, then it gives them more resources to think. It's almost thinking outside the box, but it's not, because it really is common sense in some ways. But those are one of the events that I do. Another one is collaboration. I mean, even at the hospital level, and that's what I'd love to recreate, is you have the ER, you've got the OBGYN, breast surgeon. I mean, you have different specialties, and if you see them in a panel speaking directly to patients, that's the senior homes too, or places where I want to bring these providers in to really engage direct to patient and be able to ask Q&A. I mean, and have their family members with them, and make it an event that's really collaborative between specialists, but also really touching the patients and their families.
And I think that that's one of the things that I see that's very pivotal, is touching the patients and their families, because of course, you know, in the health system, that you think of it like, okay, this is a patient and you do your routine, because those are the things that we have to do to provide that excellent patient care. But at the end of the day, of course, like their family members and their friends. So I feel like that collaboration is actually life-changing for a lot of these cases. So for these providers to know each other and be able to kind of pick some of the referrals based on what is best for a certain patient, that is amazing. So I love that you're doing that work and setting up these events. Can you tell us a little bit about maybe some of the upcoming events you might be doing, or if a provider wanted to work with you or reach out to you to get associated with something that you're putting on? Can you tell us a little bit about how they might find you?
Absolutely, yes. So you can find me. Most people have my cell phone. I also have a social media presence with SB Network, and through word of mouth. A lot of people I've either worked with in the past, or it's word of mouth, but there are these mixers I do like to do, and we'll invite different groups and collaborate together. Maybe it's 2 or 3 sponsors involved, but those are wonderful, because I just say pass on to anyone. Like, the more the merrier. Go ahead and pass along the invite, and it's fun to see, especially being in healthcare for 20 odd years. It's like back to my pharma days. Somebody will walk through the door and now they've gone off on their own, or they will tell me what they're doing now. And it's nice, because if you open it up to everybody, I think people that truly want to connect and want that personal connection, then that's who comes through the doors.
And that's the best ever, I think, right there, is just that level of knowing each other and camaraderie and familiarity of, you know, running into people in the healthcare space that might know each other as well. And I think that familiarity does, in the end, enhance and and breed those positive patient outcomes. So I love that. Well, I would love for any of our viewers today to reach out to Sarah, of course, connect. You'll find her socials, her links. I don't know if we'll put her cell phone, but we'll find a way to get it to you if you really need it.
You can always message me too.
Yeah, you can message Sarah, of course, too. But it's one of the things that in this market, in the Dallas market where we are in the healthcare space, there's really a mission and a movement to connect some of these providers. And if you're looking for somebody to connect with, Sarah is a great resource. And as mentioned, she has worked in the healthcare space for more than 20 years. So highly encourage you to reach out. And thanks for watching today, guys. Stay tuned for the next episode.
Thank you, and thank you for having me.
Yeah.